a high volume aerosol suction. So obviously you have suction in the dental office that sucks your spit and everything like that, but we have a very, very large aerosol vacuum that sits a couple inches away from the patient's face, and what it does is when you're doing dentistry, you're producing a lot of aerosol from the water and everything else, and that's getting aerosolized into the air. And we're trying to trap as much as we can of that by vacuuming it off as it's coming out. And lastly is supplemental oxygen. Oxygen is vital for life, and keeping that in there will help eliminate some of the toxins as well. But so in there, you'll see a couple pictures in there too, but it's a lot of stuff on the patient, I'll tell you that. But it's what we have to do. Patients are given usually a slurry of either charcoal or chlorella, which are also big heavy metal binders. They rinse their mouth with that. Someone swallow it, someone spit it out. It all depends on the preference. I'm not really big on that. But a full barrier is put on. I'm talking from shins up. Eyes are covered, ears, face, everything. External oxygen is given via nasal cannula, just like you'd have at a hospital, an oxygen tank there. A dental dam is placed. Now, haven't you guys ever had a root canal before? Okay, so that big thing that fits on your mouth, that's super uncomfortable, gotta put it on. But what that does is it allows you to isolate that single tooth or teeth that are in that area and prevent as much material as we possibly can from getting in the patient's mouth. And once that's placed and sealed, we put a saliva ejector into the mouth as well. Vacuum's turned on and we use tons and tons and tons of water because we want to reduce as much heat as possible. Because like I said, you need to heat that up a little bit, it's going to vaporize as much as possible. A lot of water, and we cut it into as small chunks as possible and try not to grind it out. Sometimes that's not possible and that's just the way it is, but because we can section into big, smaller pieces and get it out, it eliminates as much as kept it within the material itself. Afterwards, we rinse the patient's mouth again. As far as dental staff is concerned, I'm wearing my typical protective gear that I'm always wearing, but I'm also wearing a charcoal filter mask. So underneath my normal mask, I have a mask that's charcoal filtered and blocks that. I have to get a new one every, I think it's about 36 hours it's good for. Face shield, everything, and the goal is to reduce as much exposure as possible. Now, are we gonna eliminate all of it? No, there's no way. But the goal is to reduce it to a level where it's not gonna cause any problems. And that is why supplements are so important afterwards. Like I said, you can eliminate as much as we can, but there's still maybe a little we missed that may have fallen in, on your lip or something like that, where charcoal and chlorella come in big binders and big, and very, very important. And lastly, is I always tell patients too, is that a lot of times some people who may have issues related to potentially mercury, is that when sometimes the mercuries are taken out, or even when they're detoxing, the stories I've heard from people is that sometimes their symptoms can get worse because you are starting to detox, you're starting to cause more to be released. But typically that resolves in a little time once things are really, really cleaned out. So, a couple really good sources for information on this. More of this is, one is smartchoice.com, which is basically the patient equivalent of teaching, what needs to be done in terms of, getting it out in a safe manner. And also the International Academy of Oral Medicine and Toxicology. I can write these up for you guys if you want to. .org. They have a whole host of information in terms of, books, videos, all sorts of stuff. And this is one of the books that's really good for them. This one is called the Dental Mercury Detox. I think this book is like $5 or $6. It's pretty cheap. But it's got a lot of good information in it, in terms of, what supplements might work for you, when you should take them, stuff like that. And also, it's eye-opening, and talking about pharmaceuticals as well. So I hope that was a little bit informative. I'm sorry if I talk fast. I tend to talk fast. What questions do you guys have for me? I know you got it. Go ahead.
Obviously, the American Dental Society doesn't approve of what you're doing.
No, but I don't take out anything in really unless it's broken or decayed. If there's a lot of saying, and sometimes if it's not broke, don't fix it. But if it's something that may be causing a problem and it's something of concern from you, then that's your choice. I don't push treatment at all. I never have. I never will.
No, but if you want to change a filling from silver amalgam to plastic or whatever you use, it's not approved, right?
It is in terms of cosmetics. I'm not saying this is going to improve your health at all. I never have and I never will.
You just said everything is going to, okay.
Well, can I speak to that? I had mine done in 2010 in North Carolina. I also had the root canal done.
Okay.
two different, and I have the MTHFR,
Mhm.
just one step though.
Yep.
And I was just toxic, so I had to go to a little center first to get detox. So when I've been eating healthy for a very long time as a result of it, I felt like a new person on the first day when, of course, he used sedation.
Okay.
Let's see, conscious sedation, I think. But he had all the equipment. I mean, Holder Clark was in his realm of people, so to speak. And stayed at a hotel nearby. At 4 o'clock that afternoon, when the bleeding was stopped, I was ready to go out to eat.
That's great.
No, it made a huge difference. And then later, we did the other side, which involved taking out some screws that had been taken in from surgery that went bad. I could not believe how good I felt. Now, I still have chemical sensitivities. I have multiple chemical sensitivities, but that was life-changing for me. In case,
Yeah.
and I don't know him, and he's not paying me. I actually claim I
Oh, I-
came because I'm looking for
I
a holistic
approve of
dentist.
everything he wants to do, but I'm just saying, American Dental Society doesn't approve of it because they think silver amalgam fillings are okay. So you go to a
But the
regular,
dentist
you
don't
go to a
wanna take 'em
regular
out.
dentist, and they won't do it.
Yeah.
You go to him, he'll do it.
The biggest problem, I'm sorry, but the biggest problem there is that they allow dentists to remove them who aren't smart qualified.
Okay,
That
I'm
is
kind of concerned about this whole thing. Many years have passed by since in 1959, they've already reinstituted the mercury fillings. But all that time since, most people have heard that mercury is not good for you. I have had mercury taken out and replaced by the white.
Yep.
So I'm concerned about what the toxicity is. In other words, when you remove it, there's a
Mhm.
lot of gas released.
So,
I don't quite understand.
okay, so mercury itself, like I said in the very beginning, is liquid at room temperature. So it's a metal, but because it's liquid, it's very easily produced into a gas. So how do we make water vapor? You heat up water. Okay, it's very same principle. So now you have a liquid that's metal. You add heat to it, which can be from chewing, drinking hot coffee, or introducing a dental drill to it.
Yeah.
That produces a lot
Yeah,
of
I'm
heat.
trying to, when you take the metal out
Yes.
of your mouth.
Okay.
Of course, it's, a lot of times, it's hard to take the full thing, they actually gotta break it up, I know when mine were removed. So I
Mhm.
wanted to get the white, I don't know what
Yes.
kind of, I was gonna get to that question now, what kind of material is that white? Those don't last too long, but they're not toxic, are they? But I'm
No.
concerned, because I've already had this done, I've kind of had, toxic poison in my system now, I'm just gonna, I'm kind of confused with this, I thought, like, many years have passed by, and I think a lot of people have removed their mercury and replaced it with white.
Yeah, and honestly, there's very few dentists, in my opinion, that I've met that even put them in anymore. And I'll tell you the number one reason. People go, I don't like the way it looks. I don't want that. Okay, that's great. And
You mean the mercury or
the mercury,
white?
the mercury. But yeah, if you've had them removed, okay, fine. You've had them removed, but you shouldn't be having any more mercury that's off gassing because they're not there anymore. Whether or not there's still some, bioaccumulated within your body, it's hard to say to that.
Yeah, and I can't recall the procedure he did, whether I was wearing some kind of mask or whether he was taking precautions or anything. I can't even remember that.
Yeah.
I just thought it was just simple technique. He just took it out and stuck another thing. I didn't know there was poisonous, toxic fumes coming out and I can get sick,
Yeah, I agree with her because I've gone to the dentist in my history and I've gotten concerns about the mercury. And they say, no, we just use the suction and everything and so forth. But the question I had is these are old mercury fillings that I have. How long can it purge? I mean, do I have a shelf life or maybe it's all gone now?
To be honest with you, I don't have an answer for you for that.
Okay, and a dentist told me that, because we were talking about the fillings, and I mentioned that they're toxic, and they said these can last for years, because they're very strong.
So-
metal,
Unless you eat cilantro, coriander, and sweat too much. Even sauna. Sauna gonna help you to take out the sauna, yes.
Sauna.
Sauna.
Yeah, she's right. Cilantro is a huge detoxifier with chlorella and charcoal. Those are really, really big ones. Yes, go ahead.
Yes, I wanted to know your opinion about very, very old root canals that have metal crowns over them, and then of course the white on top of it, and the gums receded over the years so you can see the metal, especially in regards to people who've been diagnosed with cancer. I've heard there are some clinics, and I've had people say that they won't even treat you until you have your root canals removed, because do you think that's as bad or worse than the mercury?
I think you get to a very slippery slope with some of that stuff like that. I'm a huge proponent of trying to save what God gave you, but you do get to a point sometimes, and I always tell patients that. I did watch that same documentary video that was out on Netflix, root cause and like that, and I think you have to take everything with a little bit of a grain of salt as well. Now, when you have a root canal done, yeah, there's tons and tons of tubules in that tooth, and they do as much as they possibly can to, disinfect that area and fill it. Can you still have some inflammation in that area? Yeah, potentially. I'm not going to say no. But once again, there's people who, I have 2 root canals. They were due to trauma and they were not due to decay. So there's another one's a completely different situation. So I never had any bacteria introduced in that system whatsoever. I got hit in the mouth and I severed the nerve from the tooth inside of it. So then there was never a fracture of the tooth. There was never decay on that tooth. But if I hadn't done it, that tooth's going to turn black and change colors because the nerve dies inside. That being said, the inside of it is a sterile environment. When you have a decay that gets to the nerve of the tooth and your tooth dies because of that, that's not a sterile environment. There's decay already there. It's already kind of toxic. So when you have that, your long-term success on a root canal is a little bit less versus if it's what we call a vital tooth. You have a non-vital tooth, which means the tooth's not alive anymore, means it's been decayed, it's had an abscess, your success is a little bit less. When patients go and they say, hey, my root canal's bothering me, I'm going to go have it redone. Every time you redo that, your success rate drops a little bit too. So I've never told a patient that in this day and age, there's better options out there. And to address your too with the root canal and cancer thing, in my opinion, correlation does not mean causation. If you look at the population of people who tend to have cancer and the population of people who tend to potentially have a root canal, the age population of those 2 people is very, very similar. So it's not, I'm not going to sit here and say that that's the cause of that. Is it a source of inflammation in the body? Yeah, potentially. But I don't, in my opinion, I don't think it's a root cause.
Okay, and I just had one other question. I
Sure.
had a heavy metals test done, and my mercury came out at 8.8. I don't know if this is a standard chart. It was access was allowed, and it's in the chart. It's almost all the way to the very end, to the edge. Do you think that's extremely high, or is each test? Do they use different?